After that good presentation, now we're going for physical activities that we require anyway. Um, Thank you, Dr. Martino. Kutrombi, is it?
Sorry, yes, it's
Yes, it's
Greek.
okay.
Yeah,
It's
it's
no problem.
Putrumpi, yes.
She's going to speak about exercise as medicine, tailoring movement therapies for remedies. Dr. Martina is a clinical exercise psychology,
Physiologist.
physiologist,
Yes.
lecturer at University of Greater Manchester, United Kingdom.
Thank you, and it's a great honor to be here today with you. Well, exercise has been previously described and presented, but today with me and in this section, we are gonna go a little bit deeper and maybe answer some questions. So I'm happy to be here because I'm gonna talk about my passion, exercise. And we all know nowadays that we are designed to move, and when we don't move, our health deteriorates. Even when we are healthy, we start uh, losing muscle mass and difficulty to move. Imagine then when we are talking about RMDs. And I come from a clinical environment, 20 years of practice. So let's deep dive and see any questions. So today's session, we're going to explain why exercise matters. We're going to bust some myths about exercise. The many phases of exercise, we're going to have a look on that. Some real stories from people who benefited, and a few tips to get started and keep going, because that's the difficult part. Imagine that recent research and publications are giving us the information that only 18% globally of the population is exercising regularly. So most of us, including me, periods of big periods of our yearly time, we don't exercise. So how are we going to incorporate regularly exercise to our daily routine? Movement and generally physical activity is something that we all know since we started walking. So we can hear many information on that, but it's a whole science behind it to do it properly. Okay, so let's go for it. And of course, at the end, a few key messages to remember. So first of all, on RMDs, why we need to tailor and prescribe individualized exercise because of the heterogeneity of the disease. And the pain phenotype, of course, is another reason. The disabilities and the comorbidities that might go together with the disease. And then the therapeutic goals and the personal goals of each patient is different, and the fatigue levels are different, the disease activity is different, the mood of any session might be different, and of course, our work routine. And I would love the fact that while I'm presenting, somebody at the back is exercising, and I would like to do the same. But let's try and get you inspired, okay? So risk and benefit optimization, of course, is another reason to individualize the exercise programs. Flare-aware programming, they have to be combined with exercise, joint protection, fatigue management. And definitely uh, exercise and physical activity should be accessible to everybody. So we have many tools on our hands, like supervised, home-based, digital, hybrid, name it, okay? So just a quick overview of the latest data we have on exercise. And we know specifically for rheumatoid arthritis that a combination of aerobic and strengthening exercise improve pain and function. On axial spondyloarthritis, exercise improves functional ability and disease activity, fatigue, spinal pain, joint pain or swelling, morning stiffness, and mobility. And it's quite late, this publication, like 2025. And on osteoarthritis, of course, the EULAR guidelines are emphasizing that exercise is a core management tool to use to help RMD patients. And if you see the picture next to it, we have a combination of weight control and patient education, really important to be successful on our goals. And the central mechanism is that exercise can improve inflammatory profiles, especially this publication 2024, which is quite late, on axial spondyloarthritis patients. And anti-inflammation effect is really, really important. And let's just summarize using guidelines from the European and the American associations. Exercise keeps joints flexible, keeps muscles strong, improves mood and energy, reduces pain and stiffness, and helps daily activities feel easier. So it's a really important tool. And myths that we usually, as we are, who are, prescribing and supervising exercise programs for patients, we usually hear about. So that's why I put those two. The first one is exercise will wear out my joints. It's something we usually, well, my audience here is quite educated, but don't believe that everybody has the same knowledge that you all have. So I used to hear that a lot. So it has to do with safe exercise protocols, individualized, personalized. It's the most important. And then we can go and say, yes, it will protect our joints and reduces the pain. And the second myth is rest is bad when I'm fatigued, when I'm tired. And we know from recent data that smart movement helps. When we say smart, we mean, again, individualized timing is really important, and even on tired days, okay? So just an overview of the guidelines for us, exercise scientists, a flagship to follow for guidelines is the American College of Sports Medicine. Every 2 years, they publish new guidelines on general population, but on different diseases. So what they published for 2027 is a holistic approach with an individualized, again, as I said, on RMDs through exercise, focusing on strengthening flexibility and aerobic using wearable technology. And again, the updated version we had lately, we said that hip and knee osteoarthritis especially will be benefited to get managed from exercise, which is structured and progressive. And of course, the Americans, 2022, they published the guidelines with a strong evidence that consistent exercise, so that's what I said before, and specific modalities combined with pharmacological agents will be able to help manage the disease. And everything disappeared, okay, back. And of course, all guidelines align with the general guidelines from the World Health Organization on physical activity, which specifies that we need to tailor intensity and comorbidity screening, something which is not usually done. Screening and assessment is usually skipped. We need to assess before we prescribe and we design the exercise program. So the general physical activity target for the general population, and it's the same that, I mean, everybody should have on the back of our heads, and then we individualize, is exercise aerobically in moderate intensity for at least 150 minutes per week, and at least twice days per week, go for strengthening exercises, and of course, adapt for flares and fatigue. Okay, so mix and match. We have many tools, exercises, thousands of different techniques, different types. So let's just give you a few ideas of aerobic means walking, cycling, aquatic exercises. Interval options are really, really helpful for low tolerance. Interval means that instead of going for 30 minutes continuously, I can intermit the same duration in 3 different separated 10 minutes sessions, and I will have the same effect. Then resistance, neuromuscular, very important, especially when we are talking about osteoarthritis, mobility and flexibility. My colleagues, my professional area usually forget to incorporate that on the exercise session. And it's really important. Uh, I always specify to patients that use a stretching exercise after each set, not after each exercise. Like you do 10 repetitions, stretch, 10 repetitions, stretch, anti-inflammatory effect. Really, really important. And of course, the range of movement, the tissue tolerance, okay, will help. And of course, we need to use exercise as a relaxation technique as well, through yoga, Pilates, Tai Chi. We've seen an evidence of improved function, reduce pain, and improve quality of life. So, what is exercises medicine? Because I'm an ambassador today of the National Center of Greece of Exercises Medicine. It's a global health initiative. Most countries of the planet has this initiative trying to convince politicians, patients, and doctors to incorporate exercise on their everyday routine as a therapeutic mean. So if exercise could be packaged in a pill, it would be the most widely prescribed and beneficial drug. Unfortunately, we cannot do that. We need to move our bodies. But one of the basic, we have many principles to design an exercise program, but one of the main exercise principles that are focusing today because of individualization is the FIT principle, where F stands for frequency, how often, and go and parallel that with the drug. So how often am I going to take this drug? Every day, every 2 days. How hard, how much effort should I go for? And if it was a drug, we would have asked the doctor, how many milligrams should I take? It's the same thing. So for how long am I going to do the exercise? So for how long am I going to take this medicine? And what kind of exercise should I do? Or what kind of drug should I take? So it's a parallel we usually use. So about a frequency, all guidelines that I presented before say start 2 to 3 times per week, initially supervised to avoid injuries, okay, to avoid flare-ups, either in a session in an institute or in a gym or at home, and progress towards the guidelines. Intensity, you start light and then moderate at the beginning and increase to somewhat hard, of course, if it's tolerated. Joint-specific load management is really important. And time, listen to that, 10 to 30 minutes initially and accumulate volume. As I said before, intermittent exercise is another important tool we can use, but not as a beginner, okay? And type, blend modalities, aligned to goals and phenotype. Go for swimming, go for dancing, go for golf, go for just a walk with your dog. Flare protocol, we should bear in mind that and not forget at all times. Reduce intensity and volume up to 50%, prioritize mobility and breathing, and if the symptoms relieve you, then you can resume within 48 to 72 hours as settles. So, start small, summarize a little bit, build up slowly, listen to your body.
You have 4 minutes.
Yes, I'll try and keep it up. Okay, if pain or fatigue flares, ease off, do lighter movement, and then return. Okay, another good tip is the traffic light system, like green, go, amber, adjust, and red, just stop whatever you're doing and rest. How to get started, pick something you enjoy, start with 10 minutes, 3 days a week, use reminders, apps, or a friend for accountability. It's always helpful. Keep it mix it up to keep it fun. So just a few tips, especially for rheumatoid. strength focus on upper and lower multi-joints, progressive 2 to 3 sets, 8 to 12 repetitions, hand function, targeted hand and wrist exercises, fatigue management, okay, interval aerobic, as I said before, and footwear, really important. Go for specific footwear for what you're doing, specialized footwear. On axial spondyloarthritis, tailoring tips for exercise, we need daily spinal mobility, extension rotation work, posture and breathing, few examples there. Aerobic and strengthening, I said before, flexibility for anti-inflammatory effect, and of course for balance, mobility and quality of life, Tai Chi, yoga. Recent data show us that group-based supervised program enhance adherence. That's the secret, okay? And osteoarthritis, almost done, sorry. Neuromuscular for osteoarthritis, alignment, control, balance, and progress to strength and power. Don't start your first sessions with power and strength. Go for the first two kind of exercises. Those 2 to 3 times per week, and after 12 weeks, you're going to have the first measurable significant change. Aquatic exercises when high pain, and weight management and education is very, very, very important to help patients with osteoarthritis. And finally, for fibromyalgia, low and slow initiation, 5 to 10 minutes the first boots. Emphasize consistency. That's what I said before. A few of us, no, not even me, but a few people are exercising consistently. So it's quite difficult. That's the most difficult part. Mind and body and low impact aerobic, like going for a walk, go for a swim, and stretching, anti-inflammatory effect, education for pain management. Okay, red flags. When we have unexplained fever, when we have weight loss unexplained, acute hot swollen joints, stop and refer to your doctor immediately. During flares, decrease intensity, as we said before, range of movement, and maintain gentle mobility. Post-surgery, if there is this issue, or high disease activity, coordinate timing and goals. That doesn't mean that you should not exercise, just coordinate the timing and change the goals maybe. Cardiovascular screening for high-risk patients, screening again, assessment, usually it's not done. Monitor for blood pressure and intensity when there is this disease as well. And check with your doctor before you go to a new intense routine, okay? So, adherence, telerehabilitation, we've seen adherence, and you have technology now to help with apps, take reminders, questionnaires, and I'm gonna go directly, and I'm gonna skip that because I'm gonna skip the real stories. Exercise is safe, key takeaways. Exercise is safe and a core therapy across RMD, but dose it like a drug. Respect your body and listen to it. Exercise is medicine when used properly. Tailor by phenotype, goals, and weekly symptoms response. No size fits all. So whenever you hear a PA, a physical activity instructor, giving you a piece of paper with exercises, take that and go home, run home. It's not individualized and no size fits all. Blend modalities, plan for flares, measure what matters, and adapt when needed. And remember, as a tool, digital hybrid delivery boosts access and adherence. Start small and stay consistent. So live better every day. Thank you very much.
Thank you. Thank you so much. Sorry about it, but
Oh, it's okay.
time constraint. We have just for one question. Does anyone has a question that would like to ask? Well, anyway, I have a question
you.
in a way. I have a question for you in a way.
Sorry, yes.
Being that I have osteoarthritis, and you know what, you walk especially, you're touching, all the bones are cracking together.
Exactly.
So even though you don't have a flare,
You
you still have the pain of the crack. So you still have to do some walking just
No.
to.
When pain arises, whatever you do as an activity, you need to avoid that. You need to find other, types of activity. We have many. So pain is a signal of your body that what you do is not good for it. You need to stop.
Okay.
That's a general rule. Thank you for the question. Yeah.
Thank you so much. A quick question.
Yes. I'm going to be quick as well, so yeah.
Is it good for them to do weight exercises with weight? I mean, in the fitness, you know.
Yes,
So,
yes.
is it good or is it bad?
As I said before, individualized. So, who is that person? What is his fitness level? What is his age? What is the disease, the progress of the disease? Has he exercised before? We start with slow and then go up. I'm never saying no to anyone, but you just need to do it properly. Okay. I was quick, so
Thank you. Thank you so much. Thank you. We're going for the second session, please. It's about hydrotherapy and RMD, the science behind aquatic therapy for joint health. I would like to ask Professor John Gianos. Gianos. Professor John Janos is the director of postgraduate program in genomic medicine and healthcare at University of South Wales, UK. Recognized tutor in the postgraduate program of medical oncology, University of Buckingham, UK. Please proceed.
Thank you, sir. Big honor. For
You
me to
have
be here.
15 minutes, by the way. 15 minutes, please.
Of course. I'll
Thank
be
you.
very quick.
Thank you.
Okay. Okay, I'm going to talk about hydrotherapy and RMDs and the science behind it. Okay, we have the inflammatory RMDs, which you know very well. This involve chronic inflammation and often result in joint damage and disability if untreated. So we have rheumatoid arthritis, autoimmune disease, which is inflammatory disease, affecting joints, usually systematically, causes pain, swelling, and potential joint deformity. We have the systemic lupus erythematosus, a systemic autoimmune disease that affects multiple organs, including joints, skin, kidneys, and brain. We have the ankylosing spondylitis, chronic inflammation of the spine and sarcoiliac joints can lead to fusion of the spine. Psoriatic arthritis, PSA associated with psoriasis, affects joints and sometimes causes dactylitis, sausage digits. Sjögren's syndrome, autoimmune disease targeting glands that produce moisture, dry eyes, dry mouth. Systemic sclerosis, scleroderma, causes skin thickening and can affect internal organs. Vasculitis, giant cell arteriitis, and ANCA-associated vasculitis. Inflammation of blood vessels can be life-threatening. So we have the non-inflammatory, degenerative, or mechanical RMDs. Osteoarthritis, most common form, degenerative joint disease from wear and tear, osteoporosis, reduced bone density, increasing fracture risk, fibromyalgia, which is widespread musculoskeletal pain with fatigue, sleep, and mood disturbances, tendinitis, bursitis, carpal tunnel syndrome, soft tissue conditions, usually from overuse or injury, and low back pain, mechanical back pain, common and often non-specific cause of disability. Now, diagnosis and management of who treats RMDs. Blood tests, ANA, RF, IDCCP, imaging, X-ray, MRI, ultrasound. Management often involves medications, non-steroidal anti-inflammatory drugs, DMARDs, biologics, physiotherapy, and lifestyle adjustments. Biologics, they're antibodies, so they're quite toxic. They have systemic toxicity, so it's not panacea. And then we have the doctors that they deal with this, rheumatologists, which specialize in diagnosing and managing RMDs. Some milder conditions like mild osteoarthritis or back pain may be handled by primary care orthopedists or physiotherapists. So let's see now the chemical constituents in thermal mineral waters. Hydrotherapy, I'll take an example of Icaria hydrotherapy, which they have radonium and they have also chemical constituents. and they also have hypothermia. So let's go individually to each one. So the water of this thermal medicine waters, they have sulfur, which is anti-inflammatory, keratolytic, useful in arthritis and skin conditions. We have bicarbonate rich, which is anti-inflammatory, regulates pH. Oh, sorry, there is just, okay. Anti-inflammatory regulates pH, mild diuretic. Chloride rich, improves circulation, relaxes muscles. Mild diuretic is a big thing when we have hypertension, okay? So chloride rich improves circulation, relaxes muscles. Sulfate rich, detoxifying laxative effects. Iron rich may assist in anemia, fatigue, and carbonated vasodilation, which improves peripheral circulation. Vasodilation is a huge thing, especially when someone has a tendency to do thrombosis, to make thrombus. So radon in hydrotherapy. Radon is a naturally occurring radioactive gas, A emitter, often found in thermal spring waters, especially in spas located in uranium-rich regions. The mechanism of action is low-dose radon exposure, which may modulate immune responses. Modulate immune responses is huge because you have an autoimmune disease. You have to regulate the immunity there. Otherwise, you have too much inflammation. And many diseases linked to the inflammation. Stimulates the hypothalamic pituitary adrenal HPA axis, reduces inflammation through mild oxidative stress, triggering adaptive antioxidant responses, used in rheumatoid arthritis, ankylosing spondylitis, osteoarthritis, chronic back pain, fibromyalgia. Radon is a radioactive noble gas which decays into alpha particles. In balneotherapy, low-dose radiation from radon is thought to produce hormetic effects, beneficial biological responses to low-dose stressors. This is a huge thing because you activate hormetic effects, okay? You have a huge spectrum of downstream signaling pathways below it. And that can change expressions of genes disease-related. And not only that, you will see now, we can go to not just to genomics, but also to epigenomics, which is reversible. Radon proposed therapeutic effects for RMDs. Pain relief, analgesic effect. Many patients report long-term pain reduction after radon spa therapy. This effect can last weeks to months post-treatment. Anti-inflammatory effects. Radon exposure is believed to modulate immune responses, possibly reducing pro-inflammatory cytokines, interleukin-6, TNF-A, and etc. Improved joint mobility and function, especially in patients with osteoarthritis or ankylosing spondylitis. Balneotherapy can improve joint flexibility and reduce stiffness. Reduced use of pain medications. That's huge because non-steroidal anti-inflammatory, they're very toxic, especially to the kidneys. Some studies show patients decrease no steroidal anti-inflammatory drugs or corticosteroid usage following spa therapy. Enhanced quality of life, improvements in sleep, fatigue, and general well-being have been noted. Hypothesized mechanism of radon. Hormesis. Low-dose radon may stimulate cellular repair mechanisms and antioxidant defenses. Immune modulation. Radon may shift the balance of immune cells, reducing autoimmunity and chronic inflammation. Endorphin release. Similar to other spa therapies, it may promote the release of endorphins and serotonin, which makes you happier. Scientific evidence of therapeutic effects of radon. Clinical studies, mostly European, some randomized controlled trials, RCTs, and observational studies suggest statistically significant improvements in pain and function. Effects are often comparable or additive to conventional therapies. Radon levels used in hydrotherapy are very low and brief, considered safe in the therapeutic context by spa medicine practitioners. Radon therapy can be useful adjunct, but should not replace evidence-based treatments like DMARDs or biologics for autoimmune diseases. Again, biologics can be very toxic. Genomic and epigenomic effects. Research into the genomic and epigenomic impacts of radon and thermal therapies is still emerging. The study identified specific DNA methylation profiles linked to rheumatoid arthritis and its severity, pinpointing 169 CpG sites with significant methylation changes. These alterations were linked to genes involved in immune regulation and inflammation, suggesting that environmental factors, including thermal and radiant therapies, could influence disease progression through epigenetic modifications. Epigenetics is a huge topic because they are reversible. So they're the ones that they activate hereditary disease-related mutations. So if you can reverse epigenomics, you can stop the development of many diseases, multifactorial diseases, even cancer, neurodegenerative diseases, cardiovascular, etc. Immune system modulation. Radiant therapy appears to modulate immune responses, particularly influencing T helper cell populations. In a controlled trial, radon exposure led to significant increase in regulatory T cells and a decrease in the Th17 Treg ratio, indicating a shift towards a more anti-inflammatory immune profile. These changes were not observed with thermal therapy alone, highlighting the unique immunomodulatory effects of radon. Autoimmunity and antibody regulation. Thermal and radiant therapies have been associated with reductions in autoantibody levels, which are crucial in the pathogenesis of RMDs. For instance, a study reported a significant decrease in circulating adicyclic citrullinated peptide antibodies following a 3-week regimen of combined low-dose radion and hyperthermia therapy in ankylosing spondylitis patients. Similarly, a case report documented near complete recovery from RA after 15 months of low-dose radion and gamma radiation therapy, accompanied by normalization of inflammation markers. Okay, clinical evidence, supportive studies, randomized controlled trials have shown that balneotherapy with hyperthermal and radiant waters reduces pain and stiffness in RA and OA, improves quality of life and functional scores, lowers inflammatory markers, CRP. Okay, so we have the heat, the hyperthermia, which causes mass relaxation and improves circulation. We have the sulfur, the inflammatory antioxidant, carbon dioxide vasodilation, oxygenation, radion, immune modulation, pain relief, and minerals, skin absorption, electrolyte balance. Conditions treated, RA, OA, ankylosing spondylitis, from fibromyalgia. Main benefits, pain relief, reduced inflammation, improved mobility. Scientific support, moderate. Risks, low dose radiation. Typical use, adjunct to conventional treatment. So, summary, emerging evidence suggests that thermal hydrotherapy, especially when combined with radiation exposure, may exert beneficial effects in RMD patients through modulation of immune responses, including increased Treg cells and altered Th17 Treg ratios, reduction in autoantibody levels, indicating a potential decrease in autoimmune activity, and potential epigenetic modifications influencing disease progression. That's it.
Thank you so
I'm
much.
in the limit.
No, you are more than enough. That's yes, Nadia.
Yes?
So thank you for your presentation. And can I please ask, you've presented mostly the radon therapy, and you've also presented balneotherapy. And can I please ask, do you have any comments in regards to pelloid therapy? And if that is also effective when used as a singular therapy or together with balneotherapy, or could that be combined with radon therapy? Because
doing a huge
they are
trial.
all
Yes.
they are all
I'm doing a huge trial at the moment,
uh-huh.
including microRNAs, non-coding RNA genes. And it has to be a combination of all these that I talked about, not just individually. Okay? So it has to be a synergistic effect from hyperthermia, from chemical constituents, and radon. So it has to be a synergistic combination there. I'm not dealing with individual balneotherapy, whatever, I'm just going through a mixture. No,
No.
no.
So from your experience or expertise, is payload beneficial as an individual type of therapy?
No individual, as I said, he has to be synergistic.
Okay. So if you could say, yeah, okay, fine.
You know why? Because synergistically, if you see the expressions of genes that they're related to diseases, there's a huge impact. Okay, the synergistic effect is tremendous. So that's why I like synergy. And as I said, it has to be hormesis, which is a low dose radiation, which can activate all these pathways.
Agreeing with you because I've done a narrative review and I found the same. I came to the same conclusions that not anyone alone,
Exactly.
even radon therapy was
Exactly.
actually beneficial as an alone therapy.
Indeed.
It kind of works all together because of the minerals as well the radon as well the it kind of works as a combination.
Exactly.
Yeah, so that's why I asked if you had anything on peloid because peloid is used in Greece, but people don't
No.
actually know if they should do it together or not, and if you had any info on
I wish I
peloid.
had the money to do all the studies
Oh
that I
yeah,
wish,
yeah,
but
that's a
I have a
good
very
one.
tight
Yeah.
budget, I'm afraid.
Yes, another question, please. I have just one question to go. You were talking about the radon treatment. When a person is on the treatment, like for osteoarthritis, for instance,
Yes, sir.
does he have or does he actually has to stop the medication?
No. He continues, and that's an unjacked. It's a complementary treatment.
I
You don't
see.
stop anything.
You don't stop.
No. You go according to the schedule of your doctor, and then you do this. Okay?
Yes.
At the same time.
Thank you
And
so
it's
much.
helping.
Thank you so much.
There's also synergy here. It can improve therapeutic effects of the
Will it
conventional
help
treatment.
the growing of cells?
You mean the radio? No, because if you go in a high dose, yes. If you go to a low dose, it's therapeutic. See, what happens is like drugs. Anything has to do with the dosage. A drug can be therapeutic or it can be a poison
I see.
if you go OD. So it's the same thing here.
Thank you. Thank you so much.
Thank you.
Just wait. Thank you. It was quite interesting. Now we're going for our last speaker, Dr. Panagaitos. Yeah,
Panagiotis.
Vitalis.
Correct.
Right. He's going to talk about economics and daily life hacks, practical adaptations for work and home. Who is Dr. Vitalis? He's a doctor of clinical exercise physiology, University of Wolverhampton, UK. Accredited lecturer, University of Derby, UK. You have 15 minutes, please.
Thank you very much. Good afternoon. I'll try to be as concise as possible. I can understand that you're tired. So let's begin, and let's very briefly break down the term ergonomics because we're going to talk about this today and the application in our daily life. So if we make the etymology of this term, we're going to find two words, Greek words. One is ergos, or work or labor, and the other one is nomos, which refers to the natural laws. So literally, we refer to the application of laws at work. But be careful here, because when we say work, we don't necessarily mean what we do for a living. It's a much broader extent, and it's referred to a physiological perspective on our human's body, which means any bodily movement that is produced by skeletal muscles, and this produces energy expenditure. This is actually the definition of physical activity. So there is an interdisciplinary connection between these terms. And now, why ergonomics and daily life adaptations matter? Briefly, the aim is to reduce the very common symptoms of pain, fatigue, and also the limited functionality that our people experience in their daily life. Also, we want to support the independence of our individuals, make them capable in their daily life, and as a matter of that, improve their quality of life. And what about the evidence that we have so far? There is evidence that even if we do some small changes in their daily life via ergonomic strategies or by changing adaptations in their daily life, it is enough in order to improve the strain that they experience on a daily basis, the comfort, sustain energy, which is crucial, important, as you know better than I do, and as a matter of that, improve the quality of life. Now, let's focus on the work environment first, because before we move to the house environment. So at the work environment, I've utilized this slide, which is taken from a disease-specific evaluation tool for inflammatory arthritis, which is developed from a Canadian group of scientists. And as you can see, the main focus is, first of all, on the two main positions, the seated position, which is the most popular one, I suspect, when we talk for people living with RMDs, and the other one is the upright position, the standing position. Now, as you can see, there is an evaluation on the alignment of the posture from head to feet. And what we actually see here, or we try to evaluate, is to see whether the proper posture is being kept, and if not, what is evaluated is the degree of deviation and for how long this is sustained, so that we can have an overall idea of the impact that takes place on this particular body. What has actually happened on the seated position nowadays, I assume that you are already aware and familiarized with terms like ergonomic desks, ergonomic chairs, which are fully adjustable according to the individuals, keyboards, and so on and so forth, voice over recognition to minimize the typing, which is quite demanding if it is for long, and so on and so forth. What happens actually on the evaluation and the application of ergonomics on a more physically active, let's say, work environments? As you see here, this is an actual picture from the application of ergonomy of a software in an industry, where on the left-hand side, you see the person who tries to lift something which is probably heavy. And if not, this doesn't make sense, because ergonomy takes into account not only how heavy is what we lift, but how many repetitions do we have to do for this particular weight on a daily basis, in a week, in a month, and etc. So what we try to do is to analyze, and as you can see on the left-hand side, we have to prevent this lean forward on this particular case and promote the upright position here, so that we protect the person irrespective of whether he's diagnosed from RMDs or not, in order to make him safer and also more productive in terms of the company. So this can be happened via two methods. One is via adding tools that can help maintain this posture, or via changing the technique, analyzing the technique, and instead of lean forward, we have to do a proper kind of squat exercise in order to take the load from the spina and place it to the ground, kind of. Now, what about exercise, and what can we do? Because we briefly mentioned about the ergonomics. Is exercise ergonomic itself? The answer is obviously yes, it is ergonomic, because as we referred to the second slide, any bodily movement from the skeletal muscles that produce energy is part of physical activity and thus produce work, physical work. So taking the seated position as granted, or as the rule of the most common, let's say, condition for our people here, what we want to say here is not the magic exercise that we're looking for. There is no, as previously Martina said, one-size-fits-all approach, but we're looking to tailor the exercise programs as well as the ergonomy of the persons according to their needs. So if there is one answer on what mean of exercise should we do, the magic answer is stretching. Because the prolonged seated position, as you can see here, what actually happens in our body is to shrinking the muscles, and as a matter of that, there is a cross and mixed up condition as a result of the musculature, as well as with the inflammatory condition, and then the outcome is to become very difficult to differentiate at the end of the day whether I'm fatigued because I'm on a flares up, or because I suffer from rheumatoid arthritis, or whether I'm disconditioned because I'm seated prolongedly. And as a matter of that, I have to deal with these two things, which are two different ones. So what can you say in terms of flexibility and mobility? We have to keep the head to feet approach, like how we evaluate the ergonomic posture. Same is the answer. So we start from the head, and I've incorporated also eye exercises, although they are not joints. But given that it is very common, the eye issues, it's crucially important to have a neutral environment in terms of the light, the proper height of the screen, the proper distance of it, in order to prevent from leaning forward prolongedly during our stay. And as a matter of that, going downwards, exercise for our neck, any type of exercise, stretching exercise, provided that is applied, however, correctly. Shoulder exercises with a promotion of the background movements, elbow and wrist exercises because we remain there for a long time, and so on and so forth. So hip and knee exercises, and for the ankles as well, just by standing up, take a walk, make breaks. All these are, I assume, more or less we are aware of them. What we don't actually know is the magnitude of the physical effect that we have to face on a daily basis in our house environment. And even if we have papers and scientists talking about ergonomic environments in a work-based environment, what happens in our house? How ergonomic is our house? How easily accessible is it? Do we have to stir up? Is there any stairs included? Do we have to be moved from a room to room and it's difficult for numbers of reasons? How big is it? What about parking? Is it parking included kind of in the house environment? Or it's like Pagrati or some areas here in Athens where you have to park the car 4 or 5 square meters far. And as a matter of that, on a daily basis, you have, for granted, 10, 15 minutes walking on a slope, in a sloped neighborhood, not a flat condition. All these things, they have to be taken into consideration when we speak about ergonomics. And another thing, even if we have a fantastic house like this one and this car, which is right outside of the house being parked, how many time do we have to spend door to door to go to our work on a daily basis and be seated? Is it 10 minutes, 15 minutes, or more than that? And how much time do we need to go to the approximate supermarket? All this information are hugely important and has to be evaluated in order to have an effective approach. And let's become more specific now. What about the houseworks? It's a very common dialogue that I have with my people that we are working with together, a bit gloomy one day, and say, I'm not in a good mood today. And when I ask the reason why, the very common answer is, I did nothing today and I'm tired. And when I ask back, when you say you did nothing, could you please become more specific? And then the answer is, I did just some houseworks. And then the question from my end, what kind of houseworks did you do? I just cleaned the floor. If you see here, if you clean the floor, washing the floor, it's roughly, okay, don't take for granted the calories. I just utilize this because I like the illustration, of course, and also I don't agree, do course, lose weight, because if you start kneeling on the ground to wash the floor because you're going to spend roughly 200 calories, you're going to destroy your knees, of course. So I just want to give you an idea that we don't take into serious consideration the houseworks, but they do actually matter. These infographics are developed in order to take people from a sedentary lifestyle and make them more physically active, even if they're limited in terms of time, and do something in the house environment. But at the end of the day, we have to break down what we do. Another example, let's say that you have to clean the house. Okay, what about the decoration of the house? Is it a minimal format one, or is it a heavily furnished one and you have to remove heavy loads, which means a lot of effort, thus not ergonomic? And what about your technique that you do this? As you can understand, there are many details here. So in order to become more effective and more productive and more independent, which is what we're looking for, and this is the purpose of this presentation, we need to have a smart approach and make energy conservation strategies. For instance, we have to prioritize and plan our activities. If we have a big house, it's okay if we don't tidy up on a weekly basis. Hygiene is the number one and foremost, but on the other hand, we have to be realistic in our goals and according to our disease and according to our condition at that particular period of time. Number two, pace and balance. As you can understand, we have to be smart as well in order to be effective. What about technology? Some vacuum cleaners, the new ones, my wife is going to love this one because it's in an upright position, and instead of leaning forward to do the housework, you can have a more ergonomic posture. And of course, it's okay to ask for help. Okay, it's okay to have a bad day during your week. It doesn't matter. And then I have a case study here. It's Yota's story. We've been working 3 years now with Yota. She's diagnosed with rheumatoid arthritis since she was 16 years old. Today she's 60, and you can obviously see the deformations on her joints. The condition on the hands is exactly the same. It is like here in the picture. The legs, this picture is taken before she underwent operations. Now is in a much better condition. And let's see what we did with Yota. At the beginning, she's retired, so most of her time she had to spend within the house environment. The house, it was a friendly, I would say, environment according to her standards. And what we wanted to do, it was not to actually help her how to do households. She had already adapted her own style. But the key here is, given that we have these deformations, the surrounding muscle groups are affected due to this musculature here. So what we want to do is not to focus here, but on the superior joints and muscles, so that Yota would be capable to be independent in the house environment, and not only, as a mother as well. So if you ask her, the initial suggestions I gave her, like use lightweight cookware, tools with enlarged grips, it was not for her the best solution. She was very keen to do anything, and she was very open to find alternatives to be functional. So although it's here, these suggestions, if you ask Yota, she wouldn't actually agree that this helped her. Of course, we have to see about the safety on the house instead of protect her and be safe. Now, nowadays, Yota is capable to squeeze a lemon, and she can easily do this for a long time. In the beginning, she was getting easily tired due to the inability of the surrounding muscles. So I didn't help her to do this. We just tried to protect the overall action that needs a little bit of time more for her condition, as we can understand. She's quite actually capable to chop potatoes and to cook. Nobody would expect this just by seeing her deformations, but she's very capable. Her legs now has developed a surrounding process in the bloodstream, which makes her very effective, and the cardiologist is very actually happy about this. And as a matter of that, what is the key elements here in order to be finished on time? We need to remember that we have to maintain neutral joint positions no matter what we do, as much as possible anyways. We want to use larger joints when it's possible in order to reduce the load for our body, avoid prolonged static postures, as we said before, and make breaks as much as possible, again, and optimize the environment to reduce the strain. So, an effective ergonomic pathway, if we want to sum up, it would be, number one, we need to begin with the diagnosis and the symptoms. Because as you know, we manage persons and not diseases. which means even if you have the same diagnosis for two different persons, the actual condition may vary hugely between these two. Then what is the current state of the disease? Are we on a remission? Are we on a flare-up period? We ideally would like, in order to make an effective plan, to stay for 3 months stable in terms of medication, symptoms, and so on and so forth, so that we can easily start and intervene more in our program. The evaluation, it's not only about the individual, but also about the environment, according to the particular needs of this person. And then the plan that is going to be tailor-made at the end of the day has to address the disease and the symptoms of the disease, the person, of course, as we said before, the house environment, where we spend most of our time, and the work environment as well. We develop the perfect plan, and when you are in our house, we stay like this. It's like shooting our legs, or like this, or like this, or like this, or this. So even if we do our best, we destroy everything just by spending hours on these postures. So the take-home message will be ergonomic daily activity plus tailor-made exercise regimen. It's going to lead to an effective ergonomics. And let me finish with Yota's words. Except for a few brief periods when I couldn't be physically active, I have always made it priority to stay as active as possible. And my doctor has told me that this determination is what has enabled me to remain a fully capable mother and an independent individual. Thank you very much, and I'm open for questions.
Thank you. Thank you so much. Any questions that I'm not seeing?
Hi. Thank you, Panagiotis, for your presentation.
Thank
you
you.
show us the wrong sittings. Can you show us the correct sittings? Because everybody, you see how we're
It's
sitting
like,
right now.
let me just go backwards. Have you seen the backstage of the cameras on the TV when we listen to the news? And sometimes you're gonna see the women, basically, the spectators, that they are standing like this, holding this posture, which is very difficult actually to sustain. Why it is difficult? Because from a physiological perspective, isometrically, the muscles are actually activated at that momentum in order to sustain this posture. So on the seated position, we need to ensure that we don't lean backwards, because there is a degree of deviation, as we said before, which is calculated. We don't lean forward, but we stay as balanced as possible. And of course, the quality of the chair is hugely important, whether supports the erector spine, especially in that particular area, and if not, if it is not anatomically correct, it would actually be the effort that we need to do is higher. That is why we get fatigued sometimes. And that's very crucially important. Back in the time, the chairs, they weren't so much aware, or the industries, to develop ergonomic chairs to prevent, these side effects. Nowadays, you can easily find ones. The cost has been reduced, I have to say. So we have to be wise, and if we would like to spend kind of some more money, it would be really wise to do this on the chair that we spend most of the time. But it's not enough, as we said before. This is just one thing.
Again, this is impossible to sit like that. Okay,
That is
this
true.
is in the clouds. So you have to tell us, you have to show us which is the best possible, how we can sit, not like that. We're not a robot, okay? Because we're sitting like that, we're sitting like that, working like that. Okay, so you have to show us what is the best possible.
There is no one answer, because the best possible depends to the physique and the pathophysiology of the person. If we are talking about ankylosing spondyloarthritis, it is inevitable, yes. But trust me, for most of the cases, if you start learning your body to adapt in another style, it's going to be painful in the beginning. You might need to do a lot of stretching exercises, but this, trust me, most of the times is feasible. Not from day one, but this is the target. If we take for granted that we cannot do this, then we lose the game. I might sound a little bit strict, but there is no way out because we have adaptational mechanism, as you know. And given that we have been used to and exposed to the wrong way, we need just some more time to get used to it. We might not find this, we might not have this result. I agree 100%. But you're going to see miracles taking place if you start doing flexibility exercises because the erector spine is also affected from the back of our legs
Yeah.
because they're interconnected. So just by doing stretching on a down body, you're gonna see that when you are seated, you are much more released in terms of pain. So that is why I'm telling you, it's hard to say one approach only, but this adds it's gonna help a lot.
In continuation to Kathy's question, I
Yep.
have a similar question. But from my point of view, it's not how to sit down properly, but how long should I sit down properly?
Indeed.
And what is the minimum that you should? Most of us stays in office, working in office, 8 hours straight in office, and you get a 15 minutes break or whatever. So normally, the best way for the eyes, for the arms, for the back, for the legs, normally to stop sitting down and try to move. After 10 minutes, after 10 hours, I mean, after 2 hours, I don't know.
I'm not going to give an answer exact in the way you ask the question because if I say 5 and you do 3 or 6, then why? Why not? You know, what is really crucial here to say is that we need to actually rethink about the routine that we have within the house because we think about the work environment. But as I said before, to my understanding, is more important the house environment, which is most of the time not evaluated. Like, what is your routine at your own sofa in your house? And what is the posture that you keep? Or what is the chair that you spend most of the time, much more of the time that you spend probably in your office? This is more important as well. So if we have information from both environments, then we can easily say that particularly for you, given that you are not seated properly during the rest of the day as well, you have to change your chair as well in the office environment and ask from your employer to change this so that you can be benefited in the house as well. And secondly, change and this and that or whatever. How much time do you spend be seated? This is added as well. It's a way different story spend 5 minutes instead of 35 minutes to go and another 35 to return. As you can understand, it's all this information that makes a difference.
Thank you so much.
Just to add,
Oh, just one
Panagiotis,
question.
just a tip to help the conversation. On the question on I'm never seated properly and what should I do? What I usually tip people is bear in mind the proper posture that Mr. Vitalis is giving us. And whenever you find out that your body is not properly seated, just adjust even for a few seconds. And then you will lose it again and then again. But if you do that, you will start sitting properly more and more. Of course, flexibility is
Thank you, Dr. Vidalis, about everything that you have told us today. I would like to ask you, is the ergonomic
Evaluation.
thank you. Is the ergonomic evaluation covering by any fund of the government in Greece, or the patient has to pay out of their pocket to take an evaluation of what they need in their houses? And then, is there any funding from the government to adopt whatever they need in their houses?
Let me take one step backwards and tell you or ask as well out loud if there are specialists that actually evaluate the house environment for people living with RMDs. The answer is no. So there is no provision at the moment that we speak right now about the importance of this. Unlike, for instance, United States, where they do this. They have developed software, especially now with AI, that they do this kind of evaluations and they have this kind of.
In Cyprus, we have the disability office that any person that has disability can apply to have evaluation of their needs in order to adopt things in their houses. And the adoptions are paid out of the
National-
government.
National health system.
Yeah, yeah. And this is not something that, let's say, if you don't have a severe disability, it's easy to do it. But we have this, and they can, and you can be evaluated if
Yeah.
you need it.
But there is a new project in Greece running at this very time, a grant of some sort that's called Accessibility in the House. So there are some applicants that are going to be funded to adjust their houses for that exact reason. So people that have mobility and difficulties moving around
It's
the house.
happening also in Malta.
Sorry?
It's happening also in Malta.
Yeah.
Yeah.
They are going to get funds from the government to adjust
You renovate the house.
to adjust ergonomically their houses
Is
so
it
they
for
can
the
be
house ergonomy as well, or just for entering the house?
no in the house
In the house as well.
ergonomic adjustments to help them move and be more free in the house. So it's called accessibility in the house, a rough translation.
In Cyprus,
English.
in addition, we have
Yeah,
it
it's
for
new.
the work also, for the workplace. If you need, yeah.
Yeah.
And in addition, what about schools?
What about schools? Schools, I know that as Greece, we were fine from the European Union because we didn't have accessible schools. But the last 2 years, we have to admit that we've done a lot of steps forward, and now almost all of the schools, the public schools, are accessible for everyone. Yeah, but the thing is not just entering the school, because accessibility stops as you enter something. But it's not just that. That's why I asked Nadia about the interior of the house. Because if I live in a house with stairs, then what? If I have a big house just because it happened and it's difficult to be moved, then how? So it's much more than entering. Exactly.
Children, how they will be in the classroom in order to follow the teacher. But I would like also to mention that in our organization, in Cyprus League of People with Rheumatism, we're running a program that we are giving ergonomic tools to our members in order to help them to be able to open jars, to make bath, and a lot of ergonomic tools. And it's a program that we run for many, many years. And we have also a collaboration with the European University of Cyprus that they are making assessments, evaluations of patients that they need in order to have a better environment. And it's something that we are doing in our organization.
That's very important. That's very important.
Thank you so much
Thank you.
for your presentation. Thank you.